So marijuana is a plant, and from that plant we have a number of compounds that seem to show clinical promise. So THC, which is the substance in marijuana that causes the psychosis and the hallucinations and all that, the high. And then you have CBD, which has been shown to help with certain types of epilepsy or nausea. And when I talk to people about medical marijuana, I always ask them, are you talking about the compounds in the marijuana plant, or are you talking about the plant? So my hope is that we can take the compounds that are found in in marijuana, and that we can isolate them, research them, study them, put them through the FDA approval process, and then offer them to patients. That would be the proper use of the marijuana plant, to glean everything we can from this plant and use it to treat people who are suffering. The flip side of that is that what other people are talking about when they talk about medical marijuana is offering the plant. And I would say unequivocally, the plant is not medicine. The plant cannot go through the FDA approval process because you don't know the dose, you don't know the other compounds that are in there, you can't control the amount that you're getting to patients. So a plant can never be FDA approved. The best thing that a plant can do is be offered as like a supplement or an herb or something like that, but it's not a controlled way of doing this. And the compounds are so potent within the marijuana plant that if you do it with anything less than an FDA approval process and strict confines on it, it could be very dangerous to people. So the marijuana plant is not medicine. The compounds within the plant can be used medicinally, and that's a very important distinction to make. It's very important that people understand that there are patients that are suffering from various things. So you have pediatric patients that are suffering from seizures, and you have other patients that have been diagnosed with terminal cancer that are also suffering. But what people need to understand is that pediatric patients with seizures are not going to be smoking marijuana joints. That's not an appropriate way of thinking about medical marijuana, or the so-called medical marijuana. The correct way of offering the medicinal value of marijuana to these patients is to isolate the CBD component from the marijuana plant and to offer that as a therapy for patients. And actually, there are programs around the country that do just that, to try to make it more easily available to patients and their families. You don't need to be offering the plant to patients and their families in order to get the therapy that those patients need. That's a very important point. The CBD concentrations and the research that they're doing has nothing to do with the smoking of marijuana, the plant. There is a lot of confusion about this. When you talk to people, when you look on the websites, when you even go out and talk to even physicians and other clinically trained people, they'll often say, well, the research shows that marijuana does this or marijuana does that. That's not necessarily the case. The majority of those research papers are talking about the compounds within marijuana that are actually showing some promise. There's been very little research done as far as taking patients and having them smoke marijuana. So yeah, it's a very important distinction to make. A lot of people who say they're in favor of medical marijuana are actually in favor of marijuana. And that's something that a lot of individuals don't understand. If you're talking about offering medicinal value to patients, there are a lot of ways that you can offer that without offering them marijuana, the plant. And so when I talk to people and they seem unrelenting in their opinion that they have to be offering the plant to people, oftentimes what it boils down to is they see no problem with the plant and they're actually pro-marijuana and not pro-medicine for patients. There are FDA-approved products such as Marinol, which is a pharmaceutical that's been around for a number of years. There are other products that are being researched right now and going through the FDA approval process, which will hopefully be available soon. There has been a lot of discussion about making CBD, concentrated oil, more available to people for a research study or on a research basis. And actually the University of Mississippi is looking at offering that more openly to people who demonstrate a need and an interest in using it. Certainly, if people wanted to focus on those extreme cases, we could talk about writing a law just for those extreme exceptions. But the problem with the laws as they're written now is they're written very broadly, and these extreme cases that people like to talk about are just a very small sliver of the people who would be getting any sort of marijuana or the marijuana compounds based on those laws as they're written. I think marijuana is most certainly harmful. And what's very interesting is you start looking at the research, especially the research as it pertains to adolescents and chronic use in adolescents. The research is overwhelmingly saying that it is significantly bad for the health of adolescents. When you talk about the cognitive problems with those who habitually use marijuana, it was often assumed years ago that if you stopped smoking marijuana that your cognitive abilities would come back. You just needed the marijuana fog, so to speak, to clear. That is not being reflected in the research. What they're showing is that based on longitudinal studies, that individuals who habitually use marijuana, especially when they're under the age of 25, never fully regain their cognitive abilities. And that's something that's not being discussed. In addition to that, you have the risk regarding driving under the intoxication, the exacerbation or even the precipitation of psychiatric problems such as schizophrenia, depression, and anxiety. And what we're seeing more and more of is there's always been this debate of, is marijuana a gateway drug? Now the research is showing that for those who habitually use marijuana when they're young, it does something to rewire the brain and makes those patients not only more susceptible to being addicted to marijuana, but susceptible to being addicted to all other substances as well. So it's a high risk, especially in our young people. And what concerns me is that these marijuana laws, as they're written, are written in a way that parents and caregivers could sign a form and allow adolescents to use these products. And I think that's incredibly irresponsible and will lead to significant harm to our young people. So I'm an emergency physician. I trained here at UAMS and did my residency here. I left the state in 2002 to do a fellowship in international emergency medicine at Johns Hopkins, and I got a public health degree there. After being on the faculty at Johns Hopkins for a number of years, I went overseas and then came back in private practice. And I've met a lot of physicians, both academic physicians and private practice physicians. My father's a general surgeon, my brother's a general surgeon, my sister is an attorney who's focused on malpractice defense work. So our family is very well versed in the medical field, and we have a lot of friends and family who are involved in healthcare. When I go around and I talk to people about medical marijuana, the folks that are involved in healthcare, it's very similar to the conversations you would have with people in all other walks of life. A very superficial understanding they might have, about marijuana or the so-called medical marijuana, and they might say, well, I'm in favor of opening this up for people who are suffering. But when you start talking about the specifics, what I'm finding is that more and more clinical people, as they look at the research, actually fall exactly where I am, which is, there are ways of opening this up to the compounds that are within the marijuana plant and making those available to patients through further research, but not offering a plant itself to patients. That just goes against logic. If you think about it like this, with my background in international health, one of the best drugs we have for malaria still today is a drug that was developed from a tree in Peru. We get the tree bark from this tree, and we isolate a compound within it, and we make the drug quinine. And quinine is used all over the world to fight malaria. That's the correct way of doing this. Now, we don't go around and prescribe tree bark to patients if they have malaria. We prescribe the compound within the tree bark. And it's the same thing with marijuana. You could take the marijuana plant, isolate the compounds that have therapeutic value, study those, send them through the FDA approval process, and offer those to patients. And the majority of clinicians that I talk to, both nurses and physicians, when you explain that to them and you define your terms, they agree with that process and they understand why that's so important. In my opinion, this is about money, pure and simple. I was traveling in San Francisco a few months ago. I met with a friend of mine who's a big investor out there, and he's very conservative, both socially and politically. And I asked him what he was going to be doing in the next couple of months and what sort of investments he was going to be making. And he said that he was going to a big marijuana conference down in Southern California. And it really surprised me. And I said, well, why would you, a conservative, very conservative person, be interested in going to a marijuana conference? And he said, Greg, I feel obligated to do due diligence because there's so much money being poured into big marijuana these days. And that's what I think a lot of people don't understand. There's all this talk about helping people. There's all this talk about individual rights and all these political theories and political opinions. But when it comes down to it, this is a huge business, a huge industry, much bigger than big tobacco, that is pouring literally millions of dollars into marketing in an attempt to tell people that this is a safe product and that this is a healthy product and this is medicine that's going to help suffering people. And it's absolutely incorrect. My biggest concern is that when you look at the history, the states that have first approved medical marijuana, quote unquote medical marijuana, have very soon thereafter approved recreational marijuana. And I think that that's the end game here. When you talk to the people who are pushing this, and you look at the industry and the money that's behind it, I think the ultimate goal is to make marijuana free and legal for everyone, and to make a lot of money from it. And the folks that are pouring millions of dollars into marketing are going to profit immensely from this, and then they're going to step back and wash their hands of the ramifications of it and leave the teachers and the law enforcement and the public health officials to clean up the mess and take care of the folks here in Arkansas. That's my biggest concern. There are a lot of problems when you start looking and taking a broad view of the effects of marijuana on our state. And what a lot of people, I think, are missing in this debate is the effects it'll have on jobs, the effects it'll have on landlords and those who own rental property, and the effects that it'll have on the taxpayer. So, for instance, employers, it specifically says in this legislation that employers cannot discriminate against marijuana users for both the hiring and the firing of these individuals in employment situations. That is very concerning to a number of employers around the state, especially those who are worried about safe work sites and those who have employees who are working in very critical aspects of various industries. So, I run in healthcare circles. I know a number of hospital administrators who are very concerned because this law could tie their hands somewhat in selecting candidates for certain jobs, for instance, working in operating rooms or operating machinery that would be critical for patient care. So those are things that people aren't really thinking about. And with regards to landlords, I've talked to a number of individuals who have rental property, and I've talked to attorneys who are in that area, and they've looked at this legislation. And what they tell me is that patients who are using, or people who are using marijuana could, in theory, they could get the ability to grow not only within a rental property, like an apartment or a house, but actually on the grounds as well, and the landlord couldn't do anything about it. So those are significant risks to jobs and employment and to those who own property. And the other thing that I don't think people realize is I have a lot of friends who are very hardline libertarians, and they say, look, let's just stop, let's decriminalize marijuana, let's not pursue that. And what I tell them is that that's not what this law is about. This law is about calling marijuana medicine and then calling people who use marijuana patients and then trying to protect this group of people based on the fact that they are now patients. And one of the aspects of that when you start looking at this critically that really becomes evident is that if you call marijuana medicine and you call marijuana users patients, then why shouldn't the state pay to give the medicine to the patients that need it? And that's exactly what is written into this law. So specifically in this law, the tax revenue that would be generated by the sale of marijuana would go back into a fund to purchase marijuana for low-income residents in the state. And they justify that based on the fact that marijuana is now called medicine and that people who use marijuana are now classified as patients. And so there are ramifications from this legislation that aren't apparent with a superficial reading of it, but when you delve into it and you start talking to people who are in these fields, it's very, very concerning. Another aspect of marijuana and this legislation that's promoting marijuana that a lot of people don't realize is the fact that there will be edibles available in these dispensaries if this law passes. And when people think of edibles, they think of pills or tablets or things that are measured and studied. That's not what's going to be available. When you talk to people in Colorado and you see the pictures of some of the products that are being sold, it is incredibly concerning that a lot of these products mimic candy and soft drinks and other things that children like. So there are gummy bears, for instance, being sold on the market as medicinal marijuana gummy bears that have, each gummy bear has 25 milligrams of THC. Now, as a comparison, Marinol, which is prescription grade pharmaceutical FDA approved THC that comes from the marijuana plant, has between 2 and 4 milligrams of THC per tablet. So each gummy bear that's sold as, it looks exactly like a candy gummy bear, and it would be offered not as a medicine in a medicine-contained bottle, but as a pack of gummy bears, just like candy is sold over the counter, contains 25 milligrams of THC, and it has enough gummy bears in there to easily make up 250 milligrams or more of THC per the package. They have candy bars that look like Milky Ways and Reese's peanut butter cups, and they just changed the name a little bit, but the packaging is absolutely the same. I've seen sodas that are flavored sugary drinks that are laced with THC and other cannabis products. There's cotton candy and other types of candy products. So it's very obvious to me, number one, these things are not being rolled out with safety as the primary concern. And number two, they're marketing this to children and trying to sell this to young people. And these are products that absolutely will be available based on the legislation in our state and available for people with a medical marijuana card to pick up. And then, say an adult does this, they have this product in their home. What's stopping a child from looking at this and thinking, well, this is candy? And this is the whole purpose behind why we have medication containers that have child-safe locks, and why we label detergents and cleaners a certain way to keep children from ingesting these products. And furthermore, even adults don't realize how edible products affect their body. So the typical person of a typical weight, within 2 to 3 puffs of a marijuana joint, will pass the level of being intoxicated or impaired. But the problem is that with an edible product, it doesn't hit your bloodstream within the first few minutes. It actually takes about 15 to 20 minutes to really absorb. So there are cases now coming out of Colorado and other states where you have middle-aged people who are going to parties, they're drinking wine or a beer, and they're trying these edible products, including brownies and cookies, thinking that this is a benign product. Well, the problem is that these products work synergistically with alcohol. So when you take a glass of wine, you drink a glass of wine, and you eat a brownie, you think, oh, well, this isn't affecting me, so you eat a little bit more and a little bit more. And there are cases of people having frank psychosis, jumping off buildings, assaulting their family members, significant increase in car crashes and fatal car crashes because of this. So these products are really, really problematic and concerning. I talked to a clinical toxicologist at the University of Denver not long ago, and he was very concerned about marijuana in general, but he said the edible products should absolutely be banned. They are very dangerous. They're marketed to children. They're packaged in ways that attracts children. And if it were up to him, they would be banned wholesale from the state, and he's working towards that. We do not want these products in our state. They would be dangerous. They would cause immense repercussions all throughout our state. And the legislation, as is written in the books now, allows these products to be sold. I think the majority of people are saying they're in favor of this because they don't understand the specifics. If you go into a room of people and you say, what do you think about medical marijuana? The reason the medical is there is because it's a marketing tactic. It's an attempt to present marijuana as a healthy thing, as a safe thing, and something that's only for a very limited few people who really need it. When you start talking to people and you say, okay, this is what it means when you say medical marijuana, and you start saying that all these people will get it, people with a diagnosis of ADHD, fibromyalgia, insomnia, migraine headaches, the legislation would allow for that. In addition, the parents could sign a form and allow children to get a hold of these products. And then when you talk about the health risks with the cognitive deficits in adolescents who habitually use, and the car crashes, and the precipitating of psychiatric disease in patients who are using these products, when people start to understand what this really means, those numbers start to go down. My hope is that if we can just explain to people what's on the ballot and what these products actually do, that they'll rethink their position. And the majority of people I talk to, they absolutely do. And I think it's just, it's a matter of getting the message out of what is actually going on. The big marijuana industry has poured millions of dollars over the last 10 years into a nationwide campaign to convince people that marijuana is medicine and marijuana is safe. Marijuana is neither of those things. And it's up to the people of Arkansas to take a critical eye and look at this issue for themselves and realize that what is being pushed from the West Coast by these big industries is not exactly as it appears. So the marijuana plant is not medicine. It's a plant. It can never be FDA approved. It has a number of compounds in it that you cannot titrate. You can't concentrate in a way and protect patients and know exactly what you're delivering. But the compounds within the marijuana plant do seem to show some promise, and with further research, we're hopeful that they can be purified and used for medicinal purposes to help relieve suffering in patients. But no, the marijuana plant is definitely not medicine and can never be, because you can't protect patients from all the different compounds that are within it.